There are so many options when it comes to birth control, and some can be pretty costly. I'm going to introduce you to a method that you can always use when needed. The withdrawal method. Withdrawal, also known as coitus interruptus or pulling out. So, here's how it works. It is the removal of the penis from a partner's vagina before ejaculation, or coming. Withdrawal may be the most common method of birth control, since it is free and always an option for preventing contact between egg and sperm, reducing the possibility of an unintended pregnancy. While withdrawal method has been criticized as a non-method, it is 73 to 96% effective for birth control, depending on the male's knowledge of his own sexual response and self-control. This method allows for vaginal penile sex until the partner is about to come. When the partner feels he will ejaculate, he needs to withdraw his penis from the woman's vagina. This allows no contact between the sperm and vulva. Some of the positives to this withdrawal method is that you do not need a prescription, unlike other methods. If you feel that birth control is too much, this method is a perfect method that won't cost you a thing. It is completely free for anyone to use, and also it is always available, especially if no other forms of birth control are available to you at the time. If you are having sex and neither partner has a condom or the female is not on the pill, pulling out would be a good form of birth control. Also, it is more effective when used along with other forms of birth control like the pill, injections, and condoms. The negatives to this are that this method of birth control does not prevent one from HIV or AIDS. There is always a risk of pregnancy if the male does not pull out on time, or is not familiar with his own sexual response. This method can cause either or both partners anxiety if one is worried that the male will not pull out on time. So what should you know about this method? When using this method, the male has all control, so the partner must trust him during intercourse that he will pull out on time. Also, the male must be aware of his own body and familiar with his own sexual response during sex. There is a higher risk of pregnancy for those who have less sexual experience. Also, when one is under the influence of drugs or alcohol, and for teens because they are not experienced sexually. So who uses this method? About 35 million couples rely on this method for birth control. Of every 100 women whose partners use withdrawal, 4 will become pregnant, if all partners withdraw at the correct time. When used typically, 27 out of 100 women will become pregnant each year. This is why it is very important for the male partner to understand his sexual response. 56% of women who are sexually experienced have relied on the withdrawal method at least one point in their lifetime. When using the withdrawal method, there are no side effects, unlike many methods you find prescribed to you by a doctor. The contraceptive patch, hormonal injections, oral contraceptives, and hormonal implants can have side effects when using them. So the withdrawal method is a useful method when used correctly. The withdrawal works because the male pulls out before he comes, so that sperm does not come into contact with the vulva. Therefore, it doesn't fertilize the egg. It is more effective when combined with other forms of birth control. Withdrawal does not prevent one against HIV or AIDS, and it is important for the male to be familiar with his sexual response so he knows when he should pull out.